All right, welcome back to our discussion. So, we're going to go and talk about anaerobic gram negative bacilli. So, this means that these are organisms that thrive in zero oxygen concentrations. So, it's just a short discussion. We're going to move on. We're going to move on with the species of Bacteroides. Okay, so Bacteroides species are anaerobic bacteria that are indigenous to human feces. Okay, so they are usually seen in human feces. And there are two medically relevant species of Bacteroides. We have Bacteroides fragilis and Bacteroides ureolyticus. Okay, and how do we differentiate the two? Um, uh, Basically, we use antibiotic sensitivity. We use kanamycin, vancomycin, and colistin. Okay. Now the antibiotics used will have a difference between Bacteroides fragilis and Bacteroides ureolyticus. Bacteroides fragilis is resistant to all, while Bacteroides ureolyticus is susceptible to all antibiotics that we just talked about. All right. Now, what about biochemical tests? We can use biochemical tests also to differentiate these two organisms. Bacteroides fragilis is, the test that we need to use, of course, there's three: indole, lipase, and esculin. Okay, bile esculin. If you need to use bile esculin, you can use that one. For indole, Bacteroides fragilis will be variable, while ureolyticus will be negative. Negative for both organisms will be lipase, and esculin will be negative for only ureolyticus, while for fragilis it will test positive. Okay. We can also use bacteroides. We can also use catalase for bacteroides, and for bacteroides fragilis, it would test positive. Now, we have to move on with the culture media that we need to use. That we can use for bacteroides isolation, right? So we can use BBE or Bacteroides bile esculin agar. Okay, so basically, this agar contains antibiotics that prevents the growth of other microorganisms. Um, Bacteroides fragilis will grow black colonies, and Bacteroides ureolyticus will grow pitting colonies. Okay, now let's talk about pathogenic determinants. Pathogenic determinant of Bacteroides species, the most important one is, of course, the capsule. Capsule again, sir. Yeah. Let's talk about a different species of microorganisms. We're going to talk about the Fusobacterium. We have three medically important Fusobacterium species. We have Fusobacterium nuclearum, Fusobacterium necrophorum, and Fusobacterium mortiferum. Okay? Now, all species of Fusobacterium have similar antibiotic sensitivity test results. However, the antibiotics used will have the following in will be different. They would have a similar antibiotic. They would use similar antibiotic tests to differentiate it from another microorganism, for another group of microorganism that is also anaerobic. We can also use kanamycin, vancomycin, and colistin. However, as opposed to the members of Bacteroides, like I mentioned before here, okay, Fusobacterium species are resistant to kanamycin and sensitive to both vancomycin and colistin. Okay, so for Bacteroides, it's different depending on species. Okay, Bacteroides fragilis is resistant to all, whilst Bacteroides ureolyticum is sensitive to all. Fusobacterium is resistant only to kanamycin. Okay? Now, biochemical tests that may be used, basically the same again. Indole, lipase, and esculin. But, you gotta remember the three organisms that I just mentioned earlier in order. NNM. What's NNM? Nuclearum, necrophorum, mortiferum. Why do I need you guys to remember it in that order? Because it's easier to memorize the what? the biochemical pattern, right? Positive, negative, negative for nucleatum, positive, positive, negative for necrophorum, positive, negative, or variable, variable, positive, positive for mortiferum. Okay, clear? Now, what are the characteristic appearance of Fusobacterium nuclearum in culture media? Well, it looks like breadcrumbs or speckled colonies. Sometimes it would be, sometimes it will be mistaken as dirt. To be honest with you, yeah. And the appearance of Fusobacterium nuclearum in gram stains is that they are gram-negative spear-like slash scattered wheat rods. Okay. Fusobacterium nucleatum is a normal flora of what part of the human body? What parts of the human body rather? The GIT, the GUT, and of course your respiratory tract. Okay. What's GUT, sir? Genital urinary tract, gastrointestinal tract. Okay. Now, abscesses associated to Fusobacterium nuclearum can be seen in organs such as the lungs and the brain. Okay. The most virulent species of Fusobacterium is Fusobacterium necrophorum. Okay. So be mindful of that one. Additional info that you guys might need include Flabibacterium meningosepticum. It was renamed in 1995 to Chryseiobacterium meningosepticum. When I was a student, it was also renamed, but it wasn't changed in the exams. But I remember one of my students messaged me, "Sir, what's Elizabeth Kingia meningoseptica?" Well, it's when I Google searched it, it's basically Chryseiobacterium meningosepticum. Okay, now it's Elizabeth Kingia meningoseptica. Okay, so it's a gram-negative organism that's cholesterol resistant, catalase indole oxidase positive, urease negative, and nitrite variable. Where do you usually find this? This is usually found on blood smear. Sorry, not blood smears. What do you call this? Pus. Okay, so it's usually found on pus samples. Now, we're going to move on with a different discussion. Again, anaerobic microorganisms. Okay, we're going to talk about these things in depth. Let me just mute myself for a couple of minutes whilst I look for what we're going to discuss. And I'll go with be right back. Yeah, let's go with be right back for a while. 5 minutes, guys. All right, now we're going to talk about a different set of microorganisms, and it's now gram-positive organisms. Okay, let's start with the spore formers. Okay, so we have two types of spore-forming organisms. So two species of spore formers, rather, Clostridium and Bacillus. Okay, So, what tests may be used to differentiate spore formers? Well, you can use catalase test. So, for example, you have a spore-forming bacillus, a gram-positive bacillus that grew from a patient sample. One of the tests that you can do on these organisms would be to do catalase test first to differentiate whether or not it's bacillus or clostridium. Okay, so we're going to start first with the one that tested positive with catalase, and this is going to be bacillus. So assuming that your organism is bacillus, we're going to talk about some more. Okay, now all species of bacillus are motile except for bacillus anthracis. Okay, and another name for bacillus anthracis is known as the anthrax bacillus. Okay, this organism is the causative agent of what types of disease? So you have wool sorters disease, you have gastrointestinal anthrax, and cutaneous anthrax. All right, wool sorters disease is the pulmonary type of anthrax, but you can get gastrointestinal and cutaneous anthrax. Okay, majority of I remember you guys remember when there was a terrorist attack. A lot of microbiologists referred to it as a pulmonary type of anthrax. Okay, so they bioengineered anthrax spores and put it in envelopes, the powdered form, of course, and they sent packages all over the world to scare people about bioterrorism. So imagine people who are doing this just because there is some sort of just because of political or it's quite disheartening when knowledge used this way can result to harm or causing fear to people. So please be careful when you go to your practice, and always assume that every item that you're handling is an infectious agent. Okay, so when you go to the hospital and you do your work, whether or not you'll continue working as a medical technologist or clinical laboratory scientist, or you want to become physicians in the future, please consider everything as infectious agents, because majority of the people who died from anthrax is actually the people who are saving people's lives. So yeah, be careful. All right, now let's talk about the characteristics of Bacillus anthracis. So the characteristic chains produced by Bacillus anthracis resembles what? Boxcars or bamboo pole. Okay, this is the extent of what I can see from medical microbiology books. So pardon me if this sounds very vague. All right, now the location of the spore is also one thing that you need to take into consideration when you are speciating Bacillus anthracis species, because Bacillus species, because Bacillus species have a centrally located spore, as opposed to Clostridium, which can be terminal or subterminal depending on whether or not it's Clostridium tetani or not. Okay, now pathologic determinants of Bacillus anthracis includes two: it's the capsule and the anthrax toxin. Staining techniques that may be employed to demonstrate Bacillus anthracis includes gram staining, McFadden stain, or immunofluorescent stains. Okay, so I think gram staining is the most accessible for many hospitals around the world. So yeah, you can use gram staining. But if you work in a laboratory that's affluent, or also meaning it has access to a lot of supplies, I suppose you can do with immunofluorescent stains. Anyway, let's move on to the characteristic colonies produced by Bacillus anthracis. So when it grows on blood agar plates, it has a beaten egg consistency with medusa head colonies. Okay, it has a string of pearls when it's incubated in MHA, which is Muller-Hindon agar, a string of pearls, and yeah, that's the appearance. Now, differentiate the gram stain morphology of Bacillus anthracis specimen if the specimen is from the following specimens: patient sample or culture media. If it came from um, if an isolate came from patients, it usually appears encapsulated. But if it's from a culture media, like you're subculturing it, you'll see the bamboo pole or the boxcar appearance. Okay, let's talk about PLET. PLET stands for polymyxin lysosome ethylene diamine tetraacetate. Sorry. So again, that's PLET. PLET is PLET stands for polymyxin lysosome ethylene diamine tetraacetate. Okay. So describe the appearance of Bacillus anthracis in this media. It has a beaten egg white appearance, similar to what it looks like in BAP or blood agar plates. Um, in gelatin media, the appearance of Bacillus anthracis is similar to an inverted fir tree. Okay, so a fir tree looks like a pine tree. They just wanted to call it a fir tree. I don't know why they wanted to call it a fir tree, but I looked at it. I looked at it in the internet, and it looks like a pine tree, inverted, of course. Yeah. So the test used to identify Bacillus anthracis from animal carcass is the Ascoli test or the Ascoli test. What happens in this test is that you add a drop of the reagent, and there would be a precipitation at the point of contact. Bacillus species associated with food poisoning include Bacillus cereus. Okay, not serious, it's serious, as in the spelling is cereal. Okay, there are two types, of course. There's the diarrheal type and the emetic type. The emetic type happens when a person eats the preformed toxins. Okay, usually it's from fried rice. Yeah, fried rice bacillus, hence the term fried rice bacillus, I suppose. Diarrheal one comes from sauces and meats. And yeah, the test to differentiate species of bacillus include 4 tests: catalase, lecithinase, motility, and hemolysis on blood agar plates. Bacillus anthracis would be different because it's not motile and it does not produce any form of hemolytic pattern. But Bacillus cereus is beta hemolytic and it is motile. Both of them will test positive with catalase and lecithinase. Okay? Now, let's move on to the susceptibility testing to differentiate Bacillus anthracis from Bacillus cereus. Bacillus anthracis will be sensitive to penicillin, while Bacillus cereus will test resistant to penicillin. Right? So these are your answers. Let's move on. Bacillus species that is a common laboratory contaminant is Bacillus subtilis. Another name for this organism is the hay bacillus. All right, it's the hay bacillus, and this bacillus bacillus species can be differentiated again. These are species of organism that can produce the following antibiotics: polymyxins and bacitracin. Sorry, somebody texted me. Polymyxin, the organism that the bacillus species that we're going to talk about there is Bacillus polymyxa, and for bacitracin it's Bacillus licheniformis. Okay. Now, Bacillus species used as control organism for mosquito larvae in water system is Bacillus thuringiensis. Okay, these are just nice to know information. The last two slides that I just informed you about that I presented to you. Sorry, is just nice to know. Okay, let's move on to Clostridium. Okay, this will be our last discussion for the week. Yeah, we're going to come back to next week with Mycobacterium. We're going to come back next week with Mycobacterium and automated analysis. Okay. Let's move on with Clostridium. Now, Clostridium species can be classified as toxicogenic species. So the toxigenic species of Bacillus include Clostridium tetani and Clostridium botulinum. Okay, So if we talk about other members of Clostridium, it could be Clostridium perfringens or Clostridium difficile. Or, right now, they're members of the Clostridium. The Clostridium species are now members of the Clostridioides species. Okay, so let's move on with perfringens first. Um, yeah. Clostridium perfringens has the following unique characteristics. It's non-motile. It can ferment sucrose. It exhibits a double zone of hemolysis, and it is capsulated or encapsulated. Okay? Okay, these are the findings. Let's move on to another member of the Clostridium. The members that have no swollen sporangia include Clostridium perfringens and bifermentans. Okay, from the name itself, bifermentans is capable of fermenting the two sugars that we will talk about later on. All right. Now, Clostridium species that can ferment lactose includes Clostridium septicum and Clostridium perfringens. Again, these two are not toxicogenic. Just be mindful of that one. Clostridium species that cannot ferment glucose include Clostridium tetani and Clostridium histolyticum. All right. And lastly, we're going to talk about an organism or a species that cannot ferment any sugar at all. It is Clostridium tetani. Okay. Now, let's go to one key feature of Clostridium species. One of them is aerobic, and it's actually Clostridium histolyticum. Okay, majority of them are anaerobic, but Clostridium histolyticum is capable of aerobic respiration. Okay, let's talk about Clostridium tetani next. Clostridium tetani is associated with three terminologies. It's known as based on morphology, of course. I'm basing it all on morphology. Tackhead, lollipop, or tennis racket bacilli. Okay? The location of the spores is terminal. Hence, it looks like a club. Okay? There are two toxins elaborated by this organism, and this includes tetanolysin and tetanospasmin. Tetanolysin, from the name itself, it lyses blood. Tetanospasmin is a neurotoxin. Okay? Now, we have mode of transmission of Clostridium tetani or mot of tetani. Clostridium tetani. It enters the body by wounds and punctures. Okay, so yeah, you can step on a rusty nail and you might get tetanus. Yeah, that's one of the key features of this organism. But that doesn't necessarily mean that you can get it only on nail punctures or rusty nails. You can get it by exposing your wounds to soil. Okay? So be mindful of these things. That's the reason why when you are in an accident, you are always given anti-tetanus shots. Okay? Ability unique to Clostridium tetani based on its ability to cause a disease is that organisms do not leave the portal of entry. They stay in the portal of entry and colonize that place, and they release toxins there. And the disease can spread throughout the body without the organisms actually migrating somewhere else, or without the organisms colonizing some other place in the human body. Okay? Next, what is immediately done to puncture wounds to avoid tetanus? You administer anti-tetanus toxoids. All right. Now let's move on to laboratory findings of Clostridium tetani. On blood agar plates, it produces beta hemolytic colonies, which has a burnt flesh odor. Okay? And when we talk about the symptomology of this organism, it is, there are terms. We have Trismus and Rhizus sardonicus. Trismus is lockjaw. Rhizus sardonicus is peculiar smile or devil's grip. Okay? Now let's move on to a different Clostridium species, Clostridium botulinum. Another name for Clostridium botulinum is the canned goods bacilli. There are two types of botulism, of course. Classic food-borne or wound botulism, and the other one is infantile botulism. Okay, ingestion of toxins can be a classic or the or the wound-borne botulism. Infantile botulism is basically ingestion of the organisms or its spores. Okay, what's the characteristic sign of a patient with classic botulism? Flaccid paralysis. For infantile botulism, it's known as the floppy baby sign. So that's the reason why we always want kids to drink milk that has been sterilized. Okay? Next, we move on to Clostridium species associated with antibiotic related pseudomembranous colitis. This is what people get from prolonged ingestion or prolonged administration of antibiotics. Okay, the colon becomes scarce of healthy normal flora, and what overgrows is actually Clostridium difficile. Okay, the culture media used to isolate Clostridium of this organism is CFA, which is cycloserine cefoxitin fructose agar. Okay. By the way, just for added information, if you have pseudomembranous colitis associated with Clostridium difficile, um, one form of therapy is actually fecal transplant. Yes, tinatransplant na ngayon ang tae. Okay? So wag kayong mag-inarte diyan. Baka mamaya kakainom ninyo ng antibiotics, kailangan niyo na pala ng transfusion ng tae. So be mindful, okay? All right. So, let's talk about Clostridium perfringens. Clostridium perfringens is known as Bacillus aerogenes capsulatus. This is the causative agent of gas gangrene which results to myonecrosis. Okay? There are several pathogenic determinants of Clostridium perfringens. This include lecithinase, collagenase, and of course the necrotizing toxin, which results to gas gangrene. The term alpha toxin refers to refers to lecithinase, which is basically a pathologic determinant of Clostridium perfringens. Lecithinase. Okay, that's the reason. That's also the reason why I put it on the first part of this bullet. Okay, alpha toxin. It's known as alpha toxin. Toxin. Now, specimens used for the diagnosis of gas gangrene, you could use the wound discharge, you could use the pus, you could use tissue from the patient. And we have a characteristic pattern for Clostridium perfringens on blood agar plates. It exhibits double zone of hemolysis. And the reaction produced by Clostridium perfringens in milk media is described as what you call stormy fermentations. They form clouds, hence the term stormy. I know, sounds a little bit too corny, but that's basically it. Okay. Now let's talk about double zones of hemolysis caused by C. difficile, C. perfringens, caused by C. perfringens. We have what you call inner hemolysis. Okay, so the double zones hemolysis is caused by two types of toxins. We have alpha toxin and the theta toxin. So alpha toxin is basically due to the fact that lecithinase causes an outer hemolysis, resulting to an incomplete hemolysis, and complete hemolysis results to because of theta toxin, which is seen inside the inner zone of hemolysis. So these are the two types of toxins: theta toxin and alpha toxin / lecithinase. Complete toxin results to complete toxin, which is basically a complete toxin, and results to complete hemolysis in the inner zones. The outer zone is an incomplete toxin. The outer hemolysis is caused by an incomplete toxin known as lecithinase. Okay, now we can do enzymatic testing for Clostridium species, and we can differentiate two organisms. Lecitinase will test positive for Clostridium perfringens, while lipase will test positive for Clostridium botulinum. We can also use sugar fermentation to identify Clostridium species. Okay, Clostridium botulinum will test negative for all. Okay, Clostridium perfringens will be the only one that will test positive for lactose, and everybody else will test positive for glucose fermentation except for Clostridium botulinum. Demonstration of alpha toxin is done on what medium? Egg yolk medium. Okay. What reaction is observed is the Nagler's reaction, a halo opacity around colonies. Okay, colonies with antitoxin, no PTT on colonies with the outer toxins. Okay, now let's talk about the antigenic groups of C. perfringens or Clostridium perfringens causing gas gangrene. We have several antigenic groups, A, B, C, 5 groups actually. It's A, B, C, D, E. And the groups that produce lecitinase include A and E. Groups that produce which is related to human gas gangrene, is A. Okay? So the most important one that we need to take into consideration, especially in human cases, is A. A and E are capable of producing lecitinase. Okay? Another organism under the Clostridium species or Clostridioides species associated to gas gangrene is Clostridium noivei. Okay? Next, we have malignancies associated with Clostridium species. Clostridium species, specifically Clostridium septicum, have been associated to breast cancer, colon cancer, and leukemia. And that is basically it for our discussion about gram-positive cocci, gram-positive bacilli. Okay, these videos are specifically made for my students on CMCC, and hopefully you guys pass your exams. I know it will be an arduous task for you guys, but I hope you guys still pass, because nothing makes me more happy than seeing you guys pass your exams. And of course it makes me happier if it was a challenge for you to actually pass the exams, because I give extremely difficult exams because I want you guys to sit into your actual board exams and experience and think that, oh my gosh, this is an easy exam. I'm so lucky that I was taught by Mr. Manuel. Anyway, that's the end of our discussion about gram-negative and gram-positive bacilli. We're going to have a specific talk about mycobacterium before we move on to automation and parasitology. Okay, so hopefully I get to see you guys again in person next week. Okay, have a nice day and have a nice rest of the week with you guys. Have a nice rest of the week